Dr. Kathleen Behr of Behr Laser and Skincare Center, and I want to welcome you to our RHA events. We've had these great products that are new hyaluronic acid fillers to our office in the last couple years, and now we have a great new one to add, Redensity, which is great for those fine lines, and we'll go over that during this event. Fine lines around the mouth and other fine lines on the face. Please make sure after the event, if you get a text, press yes if you would like to be contacted for a consult. Those who do this within a week and get a consult will be eligible for a discount of $200 per syringe after the first syringe of RHA products. All those people will also be entered to win 2 free syringes of RHA product, which is a great product. So make sure you tune in, save up your questions. We're really excited to share with you why we have this in our office and how excited all our providers are to use this product. So we brought the RHA fillers into our office because they are a new line of fillers that are long chains, very little modification, so they match your own hyaluronic acid that's in your skin. And also, they also move with you and stretch, and which is always what we're doing. So we're talking and moving, so it's always good to have a filler that is soft, that you can't tell that you have, but just helps you look better. The RHA fillers are not modified and are better in animation, so they help move with you, and they look very natural when you have them injected, so you can't tell that you had anything done, but they just help your wrinkles look better. And we're very excited to introduce the newest one, which is the Redensity, and Redensity is specifically for those really fine lines, so it's a very soft filler that you can inject and smooth those lines without giving volume, because when you're injecting those lines around the mouth, you don't want too much volume, you just want them to be smoother. And there are also some other fine lines on the face that you can do that. So we like the Redensity for this exact cases. Any of the fine lines around the mouth or fine superficial lines on the face. So now that we have Redensity, RH2, RH3, RH4, we can treat many different areas on the face. So RH4 is the most robust and often will treat the cheeks, sometimes the chin and the jawline. RH3 is kind of universal, the medial cheeks, the nasolabial folds. RH2 is a little bit finer, so we'll treat some of this more superficial line. And then now we have Redensity, so those lines that you want to treat, that you don't want to add any volume to, that you just want to smooth. So really each person and each patient needs to be evaluated to see which filler would be right in which areas of their face, because some people have thicker skin, some people have thinner skin, and so some of them can be exchanged slightly, but now we have our whole line of RHA fillers. So almost everyone is a candidate for RHA fillers. I mean, we have our whole line, so even those people who have thinner skin, those people who have heavier skin, we can use the RHA4. Those people who have fine lines, we can use the Redensity, and we have the whole spectrum in between. So really, that's what we specialize in our office, is really doing an evaluation of each patient and seeing what fillers might be right exactly for each person, because each one is different. So that's why we do a specific evaluation for each individual. So the great thing about hyaluronic acid fillers, including RHA, is that you see the results immediately. you can just see those wrinkles disappear or those cheeks lifted right before your eyes. So it's really fun to watch, fun to do. It's like I have a paintbrush in my hands. And these results can last up to 15 months. Each person is different, and so we see them back, every 9 or 12 months, but we can see some of the results lasting up to 15 months. And like I said, those results are immediate. We're here with our lovely patient today that we're going to use Redensity on to help some of her fine lines around her mouth. So this is a very nice filler that's very soft, so it's going to help fill in these creases without giving you too much volume in those areas, because you don't. So if I look here, she has just a couple little creases on her upper lip. And pucker your upper lip for me. Pucker your lip so we can see how she puckers her lip, and we're going to also help to soften that. Now just relax. Also, we can help this very superficial line over here. So we're going to treat those areas for her today, and she should be doing very well. Thank you for attending RHA events. I hope you had a lot of information that you learned today. Please, we invite you now to stick around for a live question and answer period where we'd be glad to answer any questions that you may have about the RHA fillers. Also, make sure afterwards you're going to get a text, and if you respond yes, then you will be contacted for a consult. And if you respond yes, you'll also be entered to win in our raffle, which is 2 syringes. If you do get a consult and you decide to purchase the RHA, your second and any additional syringes will be $200 off each additional syringe after the first syringe. So again, thank you. I hope you all learned something today, and it was great to share with you.
Hi there. Thank you all for joining us this evening. We're going to go through some live Q&A with you now. I have Dr. Behr here with me, so I'm going to jump right into our questions so that we can get as many answered as possible. So it looks like one of the first ones that came through is, how is Redensity a game changer? What is different about it?
So Redensity is very stretchable. So it's very good and very fine and very soft. So it does last about a year, but it's a low concentration hyaluronic acid that almost smooths into those lines. Because when we treat the upper lip lines, we want them to smooth out with really giving out volume to that area. So we want to do that to those areas, sometimes with these smile lines, sometimes even with the crow's feet. And it's just very soft filler that will help fill those lines, but without giving too volume, because you don't want the upper lip to be puffy for that area.
Yeah, total game changer in that way for those
superficial lines. So,
if I have an appointment for filler already, can I have this particular filler?
Yes, definitely. So, I mean, that's what all our providers, I mean, we have many different fillers in the office, and we love these for in areas of animation because they really are very natural and help to move and stretch. And so, they're very good in very mobile areas. And, our providers will talk to you about what's the best filler in each area for you.
Yeah, I love how dynamic these are. can we use our gift cards?
So for this, because the first syringe is regular price, you can use your gift card. All the other syringes are $200 off. So unfortunately, we won't have you be able to use your gift cards for that, but we'll be able to have you use your gift cards for towards the first syringe.
Awesome, great deal. What can I do before my appointment to help reduce bruising or swelling?
So that's a great question. Avoid any aspirin products, even any herbal products. A lot of herbal products could cause bruising or vitamin E. Also, you can take, if you even eat pineapple, it has bromelain in it that also decreases bruising, but mainly avoid most of the blood thinners is going to be that. Also, maybe just stop using your Retin-A for a day or two. It's not going to make a huge difference, but just for any skin irritation, we'll do that.
Awesome. Is this the most natural filler?
So this is a filler that is not modified, so it's very long chain. So it's made to resemble our natural. We have hyaluronic acid in our skin. All of our hyaluronic acid fillers are natural, but these are really long chains that really are not modified, and they're made to be in very mobile areas. So when we talk and smile, they move with you. So like I said, and now we have a whole line of them. And we're really excited. The providers really love the Redensity. Like I said, for those lip lines, straw lines, smoker lines, whatever you want to call them, it just really helps soften those areas. Often we'll do it in two different ways. We'll use a cannula to kind of go underneath the skin and then go directly in the lines. Most importantly is to have your provider know the anatomy and know really where to inject it, because I'll tell you, the more you know the anatomy, the more fearful you are of the anatomy, and how important it is to know the anatomy. But we're really happy to have the Redensity, because for those fine lines, it really can help smooth them out without giving that volume in those areas we don't really want it.
Yeah, absolutely. I love how well this blends into the face, and I think that was really apparent in some of those dynamic before and afters that we just saw in the video previously. Okay, can this be used under the eyes?
Definitely. So, under the eyes is a very tricky area. Often we want to make sure you have good structure in the cheeks, because if the cheeks don't have good structure, that makes the eyes worse. So we often treat the cheeks, because then you need less filler underneath the eyes. And then under the eyes, usually I always use a cannula, which is a non-sharp instrument that has holes in the area, to just gently do a little bit of filling. You always want to undercorrect under the eyes. And it's very important to have the follow-up and to treat on the right level in those areas. But yes, definitely, probably our Redensity or the RH2 can both be used under the eyes.
Excellent. Which filler would be used for the smoker lines?
So for the smoker lines, that's where the Redensity is really a game changer. Where we have
around the mouth.
Smoker lines, can be here, can be even what we call the lip lines. Any of those superficial lines, even the crow's feet, we can use that. Even the superficial ones in the glabella, which are, very good. Sometimes when you do Botox, if they're there when you're not frowning, then you need a little bit of filler besides the Botox. You really have to have a injector that knows what they're doing, because there's important blood vessels that you don't want to inject into in that area. You want to inject superficially. Some areas, like we want to inject, deep when we're up on the forehead higher, and superficially when we're right on the bone, because depending, the vessels really change in those areas. So it's really important to have that. But the Redensity, we're so happy to have that new filler that's really a game changer.
Yeah. So it's more of a matter of which injector versus which filler, but you are all in the right place. So that's the good news. Okay. So how many areas can I get treated in one appointment? Can I do under the eyes, around the lips, and the cheeks all at the same time?
Yeah, often I do many treatments. It depends. We kind of go over. Our whole goal is to make you look better naturally. So it's really important, our follow-up, because our follow-up photos show you like, wow, I really look better, but I don't look different. And that's really our goal, is to help smooth out, make you look refreshed. Often I will do 4 or 5 syringes in one sitting. Sometimes I'll just do 1 or 2, but it really depends on what the patient wants. If they really only want 1 syringe syringe, then I'd like to concentrate on a certain area, because otherwise if you try to spread that one syringe in many different areas, you will not see any results at all.
Totally, yeah. And I think that it's awesome to like, I lost my train of thought. I'm so sorry. The little boat popped up. So I'm not sure if you're all seeing us at the same time, but please also respond to let us know how you would like to be contacted afterwards when you respond yes to get entered in our raffle and get contacted for the great specials that we have.
Yeah, so the winner of the raffle will win 2 free syringes, and the special that we have is after the first syringe, which is at regular price of $7.50. Each additional syringe will be $200 off. And this is great that we have the whole spectrum of these fillers. And we have one other exciting news coming from the same company, that they have a new neurotoxin that's going to come out that just got FDA approved. So we expect to have it in the next few months, and it's going to last a little longer. So it's going to be hopefully up to 6 months. So that's going to help us all out, and we'll be on the leading edge of that.
Yeah, super exciting news there. Who will do the procedure?
Who will do the procedure? So I have many great injectors. I mean, I have, Marissa, who's been with me 12 years. She often does different fillers for me. Julie, who her patients absolutely love her. I mean, I would have any one of my injectors do filler on me. Dr. Yato, who's so particular, is going to really care for each thing that she does. Dr. Shantram, who's been with us for a couple of years and did her fellowship last year, but she's an excellent there. And so we have so many different people, or myself. So it's yours to pick, because really, everybody does what's correct. I make sure in the office, but they all have their only slight nuances, and sometimes they fit each person differently. So, we like to have everybody find their own niche.
Yeah, that's the really cool thing about, our injectors. They all have like that wonderful training and experience, but they all have that aesthetic eye. It's almost artistic and very creative in a lot of ways. Okay, so can you use this filler and Botox together on lip lines?
Yes, definitely. So, when we use Botox on the bottom half of the face, we have to be very conservative, because we don't want to change the smile or the movement. So we often do the filler, and I think they work excellent together. So we do the filler, and then we can do a very small amount, like 4 units in the upper and lower lips. And really, it's just to stop how intense the piercing is, but not to stop the movement. So you shouldn't really notice a change in your smile, but it just stops how intense that piercing of the lips is.
Totally, yeah. That's their signature look. You look refreshed, but not like anybody would know. Are you able to discuss the cost of Redensity?
Yes, so Redensity is, similar to our other fillers. I mean, it does take a while to inject, because you're injecting very small amounts, but most of our fillers are about $750 a syringe. Like I said, we have this special with this for, after the first syringe, there's $200 off every other syringe. Wonderful. And it does last, even 12 months, which is really very good for a soft filler that is filling those lines, and usually they don't last that long.
Okay, is there going to be any bad effects in the future?
Any bad infection in the future? So luckily, all the hyaluronic acids are natural, that we have hyaluronic acids in the skin. We have to also be very careful that we clean the skin, that we inject very small amounts. We don't inject into blood vessels. We don't inject into infected skin. So we always follow up our patients very carefully, because if you do enough of anything, you may have a side effect, and we know how to treat it. It's very rare, but we want to really take care of our patients the best we can through the whole process. In the future, I see no long-term effects. Basically, these are gone, and they're just degraded with the hyaluronidases that we have in our body that are naturally degrading our own hyaluronic acids in our body.
Yeah, and all the other good news is, even though Redensity is new to us, it's actually been FDA approved in Europe for some time, so several years actually, and they've totally had no issues there. Okay, love this question. Loving my longer lasting results of previous treatments with RHA fillers. Would any of the RHA fillers be suitable to add volume to the lips?
Yeah, definitely. So often we'll use RHA3 or RHA2 in the lips. Depending on the RHA3 is going to give you a little bit more volume and going to give you a little bit more. The RHA2 is if you have a lot of lip line, like you want to just smooth the lips, almost like put a little lip gloss without much volume, then you're going to get that. So you can use both of those in the lips.
Awesome. What about the neck? Can this filler be used there?
It can. So usually we use a combinations of fillers in the neck. Often we'll use one of these fillers like the RHA2 or the Redensity in the necklace lines in those areas. Often then we'll actually use a different filler that stimulates collagen like dilute radius in over the whole neck to thicken the whole neck. So often we'll use things in combination in different areas, and that's what it's nice to have different fillers in practice.
We always say with treatments 1 + 1 can equal 10 because combination is the name of the game. Yeah. Okay, so how does longevity compare to your other filler products?
It's very good. Most of the hyaluronic acids, last anywhere from, 9 months to 2 years. And I think most of these, the fine, this is lasting a year, which is great for a fine filler. And then the others are usually up to 18 months, which is very good also. So I think they're doing very well.
Yeah, absolutely. How is migration with these fillers? Do they migrate at all?
I think, that's always a great question. I think especially the ones that you place superficial in the dermis, there's no place for them to migrate with these because they're also gradually degraded by the body. I haven't seen really a lot of migration at all with these fillers, but it's really about putting very small amounts in many different areas. It's really that you're going to get more migration if you put too much of volume of any one in any area, which we do not do in the office.
And the post-op would kind of impact that, right, with the patient?
Usually after the first day, the only thing I really don't want people to do is really have a facial massage where they put a lot of pressure on their face.
Trying to move the tissues around. Yeah. Awesome. During the consult, can providers advise on what concerns would be better addressed with filler versus Botox?
Oh, definitely. So, our whole job during the consult is education. And there's so many different procedures and machines and fillers that we can do. We try to start with the one problem and or one issue that's concerning you the most and treat that. And then we kind of, every time you come in, it's our education. Like, this is what you've done. This is what you could do. These are the options that would be best for you, and let you decide what you want to do and what you want to do, because it's really about, rejuvenation and prejuvenation. So a lot of these superficial fine fillers are also hydrating the skin, and, our collagen starts to break down early, in our 20s, unfortunately. So we really want to do things that really boost those fibroblasts to keep producing those collagens.
Speaking of collagen, does this build collagen?
So I believe that anytime you stick a needle on the skin, or especially if I go with a cannula underneath the skin, I'm stimulating a mild amount of collagen. In general, the hyaluronic acids are really more fillers, but any filler that you put into underneath the skin does stimulate a little bit. There are other fillers that we don't use, like Radius, for collagen stimulation if it's dilute, but we cannot use that like in the superficial or the smoker lines, or for specific areas to, fill.
Awesome. Okay, so if I've had Botox and other fillers done before, how soon can I have this done, and is there any contraindications?
So that's a great question. So no, usually we like to know what other fillers you've had in the face, because we only usually we only use reversible fillers that aren't completely permanent, because our face does change over time. But if there's no infection, no other things you can layer, I often layer, or people want to layer, or even if people have come in and they really have neglected and haven't done anything, often it takes a few treatments to layer and really build to get them a full tank of gas to make their face the way we want, and then you can gradually build on that.
Okay, so I know we've already mentioned that this can be injected under the eye, but what about the forehead?
So yes, so the forehead, so I do believe the forehead, so our whole thing is really global rejuvenation and making sure everything is balanced. I mean, we started in the cheeks, then, I mean, the nasolabial folds, then we went to the cheeks. Now, we even go to the temples and the hair area. And I do believe that on the forehead is an important area. It's very important that you go to somebody that knows the anatomy, because on the forehead, there's a lot of blood vessels that go up. So I do use the RH2 or the Redensity on the forehead, because often as we lose volume in the forehead, our bone becomes more prominent. That causes our eyelids to drop and we get more wrinkles because we've lost that volume. So you can use that and you put it very deep if you're going up higher, and if you're going right on the rim of the eye or the orbit, then you have to go very superficial, because that's where the blood vessels come from. So I do, but it has to be by an experienced injector.
Totally. If you already have another type of filler, does it have to be dissolved before injecting RHA?
Definitely not. So things can be definitely used in combination. I do completely believe that it can be layered, and it does very well with that.
How often can I get this filler?
We want to make sure that you're treated and not over-treated. So, it just depends where you start and what you need. I mean, sometimes, like I said, people want to start with, 4 or 5 syringes and kind of get it done. And other people want to do 1 or 2 syringes at a time and then kind of build on that. And so we really customize it for what's right for you.
So kind of a trick question here. What is the best filler you guys have?
The best filler we have, it depends on each thing. So I use all the fillers, otherwise I wouldn't carry them all. I mean, there is, I still really like the Voluma for the outer cheeks to build collagen, for the skin texture on the arms or the abdomen or above the knees. I use Dilute Radius because that's really collagen stimulated. If somebody is really hollow all over, I may still use Sculptra. For somebody really talks about in the mobile area, I love the RH products because they're just so natural. So that's why we have these different fillers, because everyone has a niche. And sometimes there's men that need more structure because their skin is thicker, and I might use a heavier filler. And then there's people that have very thin skin, and so there's different fillers, and there's different fillers that are more reactive that I might not use in somebody that has rheumatoid arthritis or collagen vascular disease, because they have a higher risk of developing things. So that's why, I think that each filler that we're going to put in each person is going to be the best for them.
Yeah, so not all fillers are the same. They're all, have their unique purpose that,
We only use ones, that are FDA approved, that we get from the company. We don't get any fillers online off of China. You don't know where they've been, where they've been stored. You really, don't want to do anything, get anything from home, because you just don't know.
Safety is
how
number one.
Safety is number one.
Yeah. Here's a good question. So I wear an N95 at work. How long after filling my smile lines / cheeks should I wait to wear the mask again?
So I think that would be right away, because that really isn't too much pressure. I mean, a lot of us and a lot of our people in the office wear the mask. So maybe even just the next day. So, might go home after the filler and just rest, and then the next day you should be fine with that.
Great. If you do get a reaction or a side effect, is this product reversible?
Yes, definitely. All of the hyaluronic acids are reversible. So that is what's so nice. And really, we always have many syringes of the products that are the things that you can reverse these products with, because you really have to have them in the office. You always want to be prepared for a side effect and to try to never have one.
Totally. Have you ever filled the temples?
All the time. I do the temples. The temples, again, is very careful anatomy. Often I will fill the temples on 2 different levels. I'll fill the temples deeply, but you have to know where to go down to the bone, and then I'll use a cannula more superficial. Often too, it's very big and modern to help fill, around the eyes. You have to go a little bit deeper into the ligaments, and that helps to stretch the ligaments and open the eyes. We also have ligaments on the face that if we inject posterior to them, they give a little bit more lift. So those are all great areas.
And this one's not a question, but I'm so excited about the new neurotoxin. We're really excited too.
So yes.
Yes. Okay, here's another one. Would you only use this product during a treatment session, or if right for the patient, would you use more than one brand / type during treatment?
That's great. You can definitely use more than one brand.
Absolutely. Let's see. What's the recovery?
What's the recovery? So, we even, it's not a contraindication if somebody's on blood thinners. We just have to warn them they may get more bruising, so their recovery may be a little longer. Luckily in the office, we have a couple different vascular lasers that if you do get bruising, we offer complimentary vascular laser treatment to help resolve the bruising much quicker, usually 2 days after the treatment. Otherwise, it's very little, and we also do have some great makeup that you can cover up light bruising.
Yeah. This is an interesting question. Will you offer a Botox club for the neurotoxin? But it's so new, we don't even know what it's going to cost yet.
I've already had that in my mind, so I'm sure because it's going to last twice as long but I'm sure that we will figure something out for our Botox club members to be able to put the money that they're putting aside for that.
Are all of the RH fillers the same price?
All of the RH fillers are the same price. We've kind of, it's really about the injection and, how trained the provider is and the expertise that we're giving you.
Is it a free consultation?
It is not a free consultation. Really, it's a consultation from both the provider and our consultation. Usually, when you do pay for the consultation, it can be forwarded to the treatment, though.
But I think if they respond yes after this, then they automatically get rid of the patient.
There you go.
In this case,
yes.
So make sure you reply yes after. And then how is this new Redensity different from RH2 and 3? So maybe you can just kind of go over
Yes. So, this new Redensity has a much higher stretch score and is much softer versus like the RH4 has the highest dynamic stretch score. So that means like if you want to put it in the cheeks, if it stretches, it bounces right back, whereas this just like smooths right out. It just blends into the area. And then the RH2 and RH3 are in between. So this is really for the superficial lines. The RH2 can be used for a little bit of the etched lines, a little bit deeper. It's the marionette. RH3 are more for the nasolabial folds or a little bit more all over, and then RH4 can be used in the jawline, some in the cheeks, in the temples. So each one's for different areas.
And let's see, is there any filler that someone with rheumatoid arthritis might avoid?
So that's a great question. So we really ask when the patient comes in, it's really important to know if their rheumatoid arthritis is currently active. So if they're currently active, we're a little less likely to use the Vicross or the longer lasting fillers, which is like the Voluma that does last up to 2 years, but it has a lot of cross-linking. It's a great filler, but if you have active, active disease at the time, active rheumatoid arthritis or different disease, we might shy away from that.
And then I attended my filler consultation a few months back. Can I make an appointment for fillers that include this new product?
Definitely.
Yeah, so just reply yes, and everyone who replies yes will be reaching out to you tomorrow or over the next few days, because hopefully we'll have a lot of people to reach out to. But it looks like the questions are slowing down now, so we'll just kind of review the specials one more time. So once again, it'll be $750 for the first syringe, which will be eligible for gift card use if you do have a gift card. Each additional syringe will be $200 off, and then that's including all of the products in the Revance or RHA line. So in order to take advantage of that deal, make sure you respond yes to the text message that you'll be getting shortly after the conclusion of this webinar. And also, if you do respond yes to that, you will be entered to win 2 free syringes. So one of you will be contacted as a winner in the next few days. So thank you all so much again for attending this evening. I hope we answered as many questions as possible. I think we got through most of them, but if there are additional questions, your provider will be happy to answer those when you come in for your consultation and treatment, and we'll see you soon. So have a good evening.
Thank
Bye.
You. Bye.